A lot of times when patients are thinking about doing in vitro fertilization, the question comes up, well, what stage do you transfer the embryos? Do you transfer them on the third day, which would be an 8-cell embryo, or do you transfer them on 5 or 6, which would be what's called a blastocyst transfer? A blastocyst transfer is an embryo that has 3 cell layers, so it's much more advanced. Instead of 8 cells, you're looking at over 100 cells, and therefore the logic would say that, well, those have to be better embryos. And actually, a few years ago, most centers were really moving heavily forward to doing all blastocyst transfers because of the notion that they would be better embryos. We've since learned that it's not right for everybody. There's certain conditions that might present where a patient would be better off having an earlier transfer. For example, we have found with our severe male factor cases, especially when we do testicular sperm extraction, those embryos, for whatever reason, seem to have a less optimal development to blastocysts. Yet, when they're transferred on day 3, the pregnancy rates are very good. And many people who were pushed to blast didn't get children, and we now know they didn't get children because the embryos just didn't do as well in culture, but they were really healthy embryos. We've had to go back and look at our own data and have basically come away with the impression that a healthy situation will be good whether it's day 3 or blast. That certain conditions probably favor one versus the other. Certainly in cases of pre-implantation genetic diagnosis, those are situations where the embryos are going to grow to blastocysts while we're waiting on the biopsy information from the 3rd day. So we like to individualize who gets pushed to blastocyst and who doesn't. And we found by far many more people getting pregnant because we decided to transfer them early. And those patients that were failures in other centers where they were trying to go to blastocysts, but the embryos just didn't make it. So they didn't make it, maybe they were genetically abnormal, but maybe they just preferred to be in their mother.